two people walk into the same clinic on the same morning. Same age. Same cholesterol. Same blood pressure. Same family history. On paper, their hearts should be aging at exactly the same rate. They aren't. One heart is functioning years older than the calendar says it should be, and neither person in that waiting room has any idea why. Neither will their doctor. Nobody in the building is trained to ask the one question that would actually explain it, because that question isn't a medical one. It's a financial one, and financial ones don't get asked in exam rooms. This is not a story about someone else. There's a real chance some version of this is already happening inside you, right now, and no test you've ever taken would have caught it, because the actual cause never shows up on a chart, a scale, or a blood panel. It shows up in a bank account, in research spread across 8 completely different fields that have never once compared notes with each other. A cardiologist studying hearts. A psychiatrist studying mood. A sociologist studying marriages that end. An HR researcher studying burnout. A public health team studying suicide rates by county. None of them set out to study the same thing. All 8 of them, it turns out, were studying the same thing anyway, from 8 different rooms, in 8 different buildings, without a single meeting between any of them. Your heart doesn't know what a bank account is. It only knows fear, and it cannot tell the difference between real danger and a red number on a screen. The same organ that would race for a genuine emergency races just as hard for an overdraft notice, and it has no way of knowing the second one won't actually kill you. In January of 2026, researchers studying over 280,000 adults found that financial strain ages the cardiovascular system almost as much as smoking or high blood pressure, arteries losing their flexibility, a heart quietly doing the work of someone a decade older than the person it belongs to, structural changes a person can't feel happening in real time. 2 people, same clinical profile, different biological age, and the only real difference between them was how much economic pressure each one was carrying, silently, for years. A separate analysis pooling multiple studies found a 19% higher risk of a major cardiac event, heart attack, stroke, cardiovascular death, among people under sustained financial stress. And in one of the longest-running heart studies of African American adults in the country, researchers found financial stress predicting new heart disease even after every traditional risk factor was accounted for: cholesterol, blood pressure, smoking, family history, all controlled for, and the financial stress still mattered anyway. Something a stethoscope will never pick up was still doing the damage. So how does a number in an app reach all the way into a blood vessel? The answer turns out to be almost insultingly simple, once someone actually connects the 2 fields that study it. If you've ever lain awake running the same 3 numbers in a loop, the balance, the due date, what's left in checking, you already know exactly what this feels like from the inside, that specific flavor of tired that sleep doesn't seem to fix. What you probably don't know is how many people are doing that exact same math, in the dark, at the exact same hour, in houses you'll never see. $18.8 trillion of household debt is currently sitting across American households, an all-time high, still climbing, and every dollar of it is capable of triggering that same 3 a.m. loop in a different house tonight, on a schedule nobody chose and nobody can switch off by trying harder. Here's the mechanical part, kept simple: the body has one alarm for danger, and it can't tell a predator from a past due notice. It reacts to both the same way, flooding the system with stress chemicals that, over months and years, stiffen blood vessels and quietly age a heart from the inside. That's the thread connecting everything in this documentary. One alarm. Every direction at once. It doesn't check the time before it goes off, and it doesn't care whether the threat is a bear or a bill, and it has been running this exact same program since long before either one existed. That same alarm has a name most people only associate with worry, not physiology. Picture standing in a grocery aisle, holding two nearly identical items, one 19 cents cheaper, and running the math for way longer than the decision deserves. Or picture your own version of it, the tab you keep reopening, the total you keep re-adding, the receipt you photograph just in case, the mental math that runs on a loop even while you're talking to someone about something else entirely. That's not indecision. That's a smoke detector that's gone off so many times it can no longer tell a candle from a house fire, full alert, tight grip on the cart, heart rate up, over 19 cents that will be forgotten in 90 seconds either way. Roughly 2 out of 3 American adults say money is their single biggest source of stress, ahead of work, health, and relationships combined, according to the American Psychological Association's most recent national survey. That's not a character trait, and it was never a discipline problem. That's a threat detector doing exactly its job, aimed at a threat it was never built to recognize, because nothing in millions of years of evolution prepared it for a checking account. Leave that detector running long enough, and it stops looking like anxiety. It starts looking like something heavier, the kind of heavy that doesn't come with an obvious cause attached, so nobody thinks to ask what it's actually attached to. Here's a small, strange mercy hidden inside otherwise grim research. The same studies that found this damage also found it's reversible, faster than most people expect, the moment the underlying pressure actually lifts. This isn't a life sentence being handed down. It's a weather system, and weather changes, sometimes faster than anyone inside it believes it will. Picture someone who simply stopped opening the banking app. Not because they've stopped caring, because looking at the number now feels like touching something hot. The mail piles up on the same corner of the counter for weeks, then months. Nobody in that house would call it a mental health condition. They just say things have felt heavy lately, and leave it there, and go make dinner like everything's fine, because most days it mostly is. Debt and depression turned out to move together, and in both directions. People carrying unsecured debt were found to be nearly 3 times as likely to be depressed, even accounting for income alone, and depression, in turn, made the debt worse. Avoidance. Impulse spending as a coping reflex. A late fee that happened because opening the app felt unbearable that week. Each one quietly feeding the other, a little tighter each time. Depression from money rarely announces itself by name. Ask someone why they're exhausted at work and they'll blame the workload every single time. Almost nobody blames the car payment, mostly because nobody's ever suggested there might be a connection worth checking. Picture a desk at 4 in the afternoon, and a task this person has done 100 times before, and hands that simply won't start it. Their manager assumes a bad week. A coworker offers coffee, which helps for about 11 minutes. Nobody in the building considers that the real damage happened at 7 that morning, doing math about a car repair, hours before anyone clocked in, invisible labor nobody puts on a timesheet, running quietly underneath work that still, somehow, mostly gets done. Researchers at the University of Georgia found exactly this in 2025, financial stress measurably raising burnout, using the same clinical scale doctors used to diagnose burnout in nurses and physicians. The lead researcher's framing was simple: pain in one part of a body eventually shows up somewhere else. Financial stress doesn't stay in the evening. It follows people to a desk and quietly spends the exact resources they need to do their job, and almost no employee wellness program is built to look for a cause that never files an insurance claim. Here's the part that should almost be funny: if it weren't happening to so many people at once, companies spend real money on burnout, wellness stipends, mental health days, ergonomic chairs, while the actual drain often started at a gas station or a mailbox, somewhere the HR department will never think to look, let alone budget for. Some of this you can, at least in theory, do something about: a budget, a side income, a harder conversation with a lender. What comes next? Almost nobody can, no matter how disciplined they are. Picture someone who did everything right, tracked every expense, cancelled every subscription, paid the smallest balance first, felt genuinely proud of the spreadsheet, standing at a gas pump watching a number climb that has nothing to do with a single decision they made. There's no bad habit to fix here. Just a receipt that costs more than it did last year, for reasons that started on the other side of the planet, in a supply chain nobody at that gas station has ever heard of. Inflation stress affected more than 3/4 of American adults in recent national surveys, and it came with sharply higher odds of both anxiety and depression, the kind of numbers that would be alarming for almost any other single cause, treated instead as background noise because everyone's experiencing it at once. Researchers think they know why it hits differently than debt. Debt at least feels like something a person chose, a decision that, in theory, a different decision might have avoided. Inflation just happens, to everyone, at once, with no decision anywhere in the chain to point to and say that's where I went wrong. Take away the choice, and you take away the one thing that usually makes stress feel survivable, a sense that there's a way out, if only the right one gets found. That helplessness rarely stays with one person for long. It walks straight into the nearest relationship, and it almost never introduces itself honestly, it just puts on a receipt's clothing and picks a fight. Picture two people in a kitchen, raised in two different houses with two different relationships to scarcity, fighting over a receipt neither will remember by name in a year. One grew up watching a parent quietly put items back at the register, embarrassed, before reaching the checkout. The other never once heard the word afford spoken out loud growing up, not even as a joke. Neither is actually arguing about the number on the paper. They're arguing in two different emotional languages that just happen to use the same digits, at 11 at night, both certain the other one simply doesn't get it. Researchers tracking over 4,500 married couples found money disagreements to be the single strongest predictor of divorce in the entire study, ahead of in-laws, ahead of chores, ahead of anything else they measured, including how the couple spent their free time together. Not because couples fought about money more often than other things. Because those fights ran longer and cut deeper, since nobody was really fighting about the receipt. They were fighting about what it represented: safety, control, being seen, being trusted, and a fight about being trusted rarely ends in 10 minutes, no matter how small the number on the receipt actually was. Everything up to this point has had a mechanism you can trace, a villain you can name, sometimes even a way out. What comes next doesn't get that treatment here, and on purpose. 7 effects in, it would be easy to reach for the same rhythm this documentary has used the whole way through: a scene, a twist, a reveal. This is the one place that rhythm gets set aside deliberately, because this subject deserves more care than a statistic usually gets, handled briefly, factually, without any of the storytelling techniques used everywhere else in this documentary. Financial hardship has long been documented as a genuine risk factor for suicide, not the only one, rarely the only one, but a real one. The CDC recorded roughly 49,000 suicide deaths in the United States in 2022, with a similar toll the year after. That number is almost never connected, publicly, to the $18.8 trillion mentioned earlier, or to the depression research, or to the burnout data. But researchers in this field increasingly treat economic security itself as a protective factor, not a footnote. In its own county-level analysis, the CDC found that areas with higher household income, broader health insurance coverage, and more financial stability had measurably lower suicide rates than areas without them, insurance coverage alone tied to rates over a quarter lower, broadband access and income showing similar patterns. That's not a documentary finding a tragic ending. That's public health research finding an actual lever, the same way the heart research found a lever, and the burnout research, and all the rest of it, economic stability, showing up again, as the thing that moves the number. If anything in this documentary has felt uncomfortably close to your own life, the discomfort deserves to be taken seriously, not carried alone. In the United States, the 988 Suicide and Crisis Lifeline is free, confidential, and available by call or text, 24 hours a day, not only in an emergency, but in the ordinary, exhausted middle of a hard financial year. That number is worth remembering, whether or not the rest of this documentary is. Here is what none of this research was ever measuring separately, even though it was published in separate journals, by separate teams, decades apart, none of them citing each other. A heart aging faster than it should. A smoke detector that can't tell a candle from a fire. A mood no one can explain. A burnout that doesn't match the workload. A helplessness with nowhere to go. A marriage arguing in 2 languages about one number. A risk factor serious enough that public health researchers now count economic security as suicide prevention. 1 nervous system. 8 doors. And a cardiologist, a psychiatrist, a marriage counselor, and an HR department, each treating the one door they specialize in, each of them right about what they're looking at, none of them looking at the whole person, because the whole person was never anyone's actual job. Nobody hands out a business card for the thing underneath all 8, and no insurance plan has a code for it either, which is part of why it's been allowed to run, uninterrupted, for this long. The 2 people who walked into that clinic never learned why their hearts had aged so differently. Their doctor didn't ask about their bank account, because cardiology doesn't usually ask that question. Their bank never asked about their chest pain either. Nobody in either building was equipped to see the whole shape of what was actually happening to either of them, only the piece that showed up on their particular chart, in their particular department, filed under their particular specialty, closed at the end of a 15-minute appointment. Multiply that pair by millions, across wards and offices and courtrooms and crisis lines that never talk to each other, and you get a single, enormous, entirely preventable pattern wearing 8 different names: heart disease, depression, burnout, divorce, as if these were unrelated strangers instead of the same signal, filed in 8 different buildings, by people who were never introduced to each other and never will be, because the system was never built to introduce them. You don't need 8 doctors to know this is happening to you. You mostly just need 1 long night, 1 avoided phone call, 1 fight that felt bigger than a receipt should allow it to feel. The research took decades to catch up to something most people already knew in their body, long before anyone published a word of it. The number never lies about what it's doing to a body. It just gets filed under 100 different names, by people with no reason to compare notes, which means, for now, the only place this picture ever fully comes together is somewhere nobody thought to look for it. A screen. 20 minutes nobody officially assigned to the subject at all. And a body count that keeps climbing for exactly as long as it keeps being counted in 8 separate rooms instead of 1.